This episode is brought to you by Set for Life Insurance. Listen, docs, one of the first steps we took to pay off our student loan debt was realizing we paid way too much for our disability insurance. That all changed when we found Set for Life Insurance. They helped us with a customized insurance policy that met our needs and, most of all, budget. To learn more, check out setforlifeinsurance.com. This episode is brought to you by Physician CEO. Finally, a business program for busy doctors just like you. Get the skills of branding, marketing, entrepreneurship, and combine those with your gifts as a physician. Be known as a doc outside the box and define your future. Learn more at physician-ceo.com/DOTB.
Welcome to Docs Outside the Box podcast. This is your official show, looking inside the minds of cutting-edge and innovative doctors. Think you'll find these stories in any medical textbook? Sorry. You're getting real life insight from men and women pushing the envelope beyond medicine. Ordinary doctors doing extraordinary things. Let's start now with your host, Dr. Nee Darko.
Hey, what's going on, everyone? This is Dr. Nee. For the first time ever, we've had guests on our show who have been doctors who have been on TV, doctors who have, been in the music industry, doctors who have done stuff on YouTube. But for the first time ever, I have to say that I've never had a doctor who was thriving both in his clinical field, but also in the field of being a magician. So I have Dr. Randall Wolf, who is a surgical pioneer within the world of cardiothoracic surgery, specifically in atrial fibrillation. Dr. Randall Wolf, welcome to Docs Outside the Box. How you doing?
Nee, I really appreciate you having me on. Really interesting. It's the kind of thing I like to do. Happy to talk to all the people that listen to you.
Absolutely. Absolutely. When your representatives contacted me and said you wanted to be on the show, I was just looking at your CV, I remember, and I'm like, wait, he wants to be on my show? What does he want to talk about? It was pretty cool. You're currently at Houston DeBakey's.
Yes, I'm in Houston, Texas Medical Center, and I'm at the Houston Methodist DeBakey Heart and Vascular Center.
A place that's very renowned.
That's where I am today, right now. So I'm coming to you from Houston, Texas, Houston Methodist Hospital.
Yeah, and wanting to talk not about the accomplishments that you've had within the realm of CV surgery, but of what you do on stage was really interesting, and that's why you're here. Before we get too far into what you're doing right now on stage, right? Because the thing that I'm really interested in, obviously, is the similarities as well as even some of the differences between what you do in the operating room, what you do in clinic versus what you do on stage. But I'd like to know more of the backstory behind this because I think it's really interesting. So you learned or got introduced into the world of magic at a really early age.
Nee, that's correct. When I was 12 to 14 years old, I was rummaging around in the attic at my mother and father's house. I came across this box that was full of magic, and I was fascinated. It was my mom's brother, who was a physician, family practitioner in Portland, Oregon. He left this behind. I brought it down. I talked to my mom, and she said, oh, yeah, our dad used to bring him magic tricks back from downtown Cincinnati from time to time, and he would play with them. Nobody ever told me about it. I thought, God, this is huge. Another time, I was at my mom and dad's house in the basement, found another box, and it had magic in it. And my dad's brother was a physician as well, a psychiatrist. So there was a medical connection right there to me when I was 12 to 14 years old, medicine and magic through my two uncles, who were certainly a couple of my role models. And Cincinnati, which most people don't know, is the home of U.S. playing cards, bicycle cards. That's where bicycle cards are made. That's where they make the cards for the casinos. So there's a lot of card magic and, as an extension, other magic in the Cincinnati area where I grew up.
What might make you shake your head a little bit? I used to put those cards on the back spokes of my back wheel when I was growing up in New York City.
You don't want,
I knew
you don't want to do that.
Hey, look, I was young, I was naive.
Oh, man. So, yeah, I got started pretty young. And I think for your listeners, and apparently a lot are in medicine or going into medicine, there's a vocation and there's an advocation. Your vocation is your medicine, but if you can, you should have an advocation. And that sounds like those are the kind of people that you interview. And that's really important. And I think a lot of times we don't ask our colleagues, hey, what else do you do? We're so focused on the medicine part and you're in the ER. And sometimes you find out they do really interesting things, but never ask them. So I think this is great to get this out there.
Well, I think oftentimes you know more than me that in life things change, right? Nothing is ever really stagnant. And how we once felt, years ago is not oftentimes the same way we collectively as a society feel, maybe 15, 20, however far years in the future. The reason why I want to direct this back towards you is now it's a lot easier. There are podcasts about doctors who are doing things outside of medicine and podcasts about so many different things, doctors who are going into real estate and so forth. I think obviously it's a lot easier to have this conversation nowadays. But what was it like trying to have a conversation with someone years back, telling them that you've discovered you have this surgical patent, you have this amazing resume, but also at the same time, you want to rock it on the stage, you want to cut someone in half. Like, what was that like? What was that like? And on stage, not as a serial killer.
In the hospital, I did not mix magic with medicine too much. And I do now a little bit, but I don't do it before the operation. I learned that it's better to do magic after the operation. And you could probably understand this, that if you do a magic trick for somebody you're going to operate on, and then you operate on them, they may wake up and go, I wonder if you really did anything. But early on in medical school, I kept it pretty separate. But I think now I combine them more and more comfortable with it. But early on, I wasn't really.
When did you decide? Because there has to be a point where you really have to get really focused on, becoming a physician. Take us from the time from when you found that box to, I'm sure you were playing around with it. I'm sure you had some experiences in that realm. Was there a point where you just had to say, look, I got to really focus on becoming a doctor? What was that?
Yes,
like?
That was medical school for sure. In medical school, magic fell by the wayside to some degree. And there were times where I maybe didn't touch anything. Magic, sometimes it's like a joke you remember or you don't remember. And then you have to, how's that joke go? You have to learn it again. But in medical school, certainly the focus was more on medicine and much, much less on my advocation of magic. And residency as well, because as you know, as a surgery resident, most of your time is taken. And when it's not, you want to sleep or eat. And think in that order, sleep first and then maybe eat. So magic came in a distant third. But once I got out and practiced, then I had a little more time and I had a little more money. And I was able to pursue the advocation of magic. When I started, there are really three different types of magic. There's close-up, there's parlor, and there's stage. And when I started, I just did close-up because close-up is inexpensive.
What does that mean? Take us through the definitions. What does that mean?
Okay, close-up is table magic. You can do it for maybe a group of 8 people. Anybody more than that, they're not going to see what you're doing. Like cards. If you're doing a card trick, hard for more than about 8 people to see what you're doing. Okay, if you do a parlor magic, those are bigger tricks. I might use jumbo cards. So maybe 60, 80, even 100 people can see what you're doing. These are bigger illusions. Well, I couldn't afford those when I was in high school and college. But once I got out, I could get some bigger stuff. And then the third level, and this is what most people see, is stage magic, grand illusions. A lot of the stuff that you see with Penn and Teller and Copperfield. Stage magic.
Great Wall of China.
Right. And
I remember that still.
Yeah. And here's the advantage. If you do close-up magic and 8 people watch you and they each pay you $20 for the show, that's great. But if you do stage magic and 2,500 people come in and watch the show, that's a lot better.
I see.
If you know what I mean.
Yeah, I know exactly what you mean.
Yeah. So most lay people in the magic term see grand illusion. Very seldom do they see close-up or a parlor unless someone's got a camera and they watch the magic that way. That's how it evolved. But you really can't afford some of the bigger things until you get out and make a little money. But I still love close-up the best, hard magic the best.
Why so?
Because it's all prestidigitation. And getting back to medical, it's very, very much like surgery. I mean, a lot like surgery.
I'm actually shocked to hear that.
Yeah, it is. First of all, it's hand-eye coordination. That's what you do in surgery. That's what you do in magic, close-up magic. Grand illusions is more, you got to have a contortionist with you. But close-up magic, it's all you. It's all your hands. So very similar there. Secondly, surgery, you have all these steps you have to learn and not much variation. Okay, maybe you can change a couple steps here or there, do 18 before you do 19 or 20 first step before you do the 20 for the 10th. But generally, you got to do them in order. Well, magic's even more rigid. Magic, every step has to be exactly in order. If you take one out of order with a card trick, you're done. So they're very similar. And secondly, you have to be so good, say in surgery, that if somebody calls you from the ER while you're in the operating room operating, you can answer that ER doc, you can tell them what tests to do while you're still doing your job. Same in magic, but it's just like surgery, but we call it differently. It's called misdirection or you're ad-libbing. But really what you're doing is you're doing the dirty work while you're doing the misdirection, just the same as a surgeon would be talking to someone in the ER while they're operating.
Now,
Does that make sense?
that makes a lot of sense. It leads me to my next question. Like, you know how you can tell, like we all can tell who's a good surgeon, who's not. And oftentimes the real difference between who's an excellent surgeon is the one who knows when not to cut, right? Is there any type of rule or something similar? Like if you were to go and, watch a magician, play to the crowd where you're just like, he's not doing it right. Like, are there any telltale signs that you can see just like that? This person is not as good or is not as well trained as one might think?
Some of it's personal preference. I enjoy the magicians most who don't make it about themselves. They make it about the trick. But some magicians are megalomaniacs and it's all about them. So I don't really appreciate that. I think it should be about the illusion and pulling somebody into this realm and mesmerizing them and saying, look, I'm going to fool you. And then you do it. And they don't even know when it happened, but all of a sudden they realize they just got badly fooled. Then you just take a bow and walk off stage. I think that's telltale. And I guess, we see that in surgery too. I mean, there are megalomaniacs in surgery too, right?
Can I say a lot of them are in your field, but I'm not going
to. No. Now, come on. Yeah, I know. So, yeah.
I'm glad you acknowledged it, Doc. Well, I'm not going to lie. Within the trauma realm too, there are a lot of megalomaniacs. But I think definitely, from outside looking in, most people would say, well, the cardiothoracic surgeons, let's leave it at that.
Yeah. Here's another. No extraneous movements. In surgery, tell who's a good surgeon because they don't have a lot of wasted movements, right?
Right.
They go for the suture, they grab it, one move, it's through, it's back out, it's tied. Same in magic. Close-up magic, you don't want any wasted motion, none.
You know what I'm interested in also is okay, you're back in the 80s training. There are no surgeon work, hour restrictions and so forth. Talk to me about what it's like to go through the process of becoming the best surgeon that you can be, but also at the same time finding time to practice this. Because it's easy to say, you work from 9 to 5 on your first job. And then obviously within what you mentioned, vocation versus avocation, on your avocation, you're working from like 6 to 11. But it doesn't work that way, in surgery. Like, when did you find time to perfect your craft?
Well, you make a very good point. I never really thought about it much, but you make a good point. There were times when the magic fell by the wayside. And I think that's true, not just for surgery, but for many specialties. There are times when you got to put your avocation aside for maybe a year, maybe 2 years, and pick it up because the training is so intense for your vocation. So yeah, it fell by the wayside from time to time. That's okay as long as you remember to get back into it. Don't forget it. That would be my recommendation to people who are working really hard in medical school or residency. That's fine, but don't forget your other passions.
I love it.
Postpone them, but don't forget them.
Tell us about the first time you went on stage. Did you bomb or did you rock it?
I rocked it because
okay.
I generally practice any illusion or trick, if you will, for about 6 months before I do it in front of people.
6 months?
Yeah. And that's maybe more than you would do with even a new surgical procedure. But with a new surgical procedure, not an iteration of something you already do, something really new, you'd really put some time and effort into it before you'd operate on a patient. Well, I think magic is even more rigid. You've got to have it down to the point when you do it that first time, you are so comfortable you can talk about something else while you're doing it. I was fine with my children. I had them on stage when they were 5 years old, and none of them have any stage fright at all.
Or
Zero.
scars.
Well, they might have a few scars. There were a couple hand chopper tricks didn't go exactly right, but
That's
you know
neither
what
here
I
nor
always
there,
say,
yeah.
when you're cutting somebody in half and the volunteer comes up and is scared, I said, don't worry. If it doesn't work, I'm a surgeon. We'll put you
There you
back
go.
together.
Now, on the real, let's get real. Like, have you cut someone in half? Not like cut, but I mean, like, have you done that trick of?
Yeah. Yeah.
Really?
Yeah, I do.
Okay.
Yeah, I have that. It's called sawing a woman in half. It's been around for 100 years. It's still a good trick, but yeah, I think people enjoy illusions. So usually when I do a show, I do a little bit of parlor. I try to do a little bit of close up, some mental magic, and then some big illusions as well. A mix of it. That's the best. But yeah, you bet.
What's it like trying to get, like, for example, like the first time you went on stage, are we talking about this was a big arena? Was this like a small club? What's it like to kind of get through the phases of getting to a point where, like, are you shooting to eventually get to Las Vegas? Like, tell us about how this all works in terms of trying to get on stage and then working a crowd and getting your name out there. How does that work?
Well, the whole process is a little bit like medicine. The big magic meetings, the International Brotherhood of Magicians, the Society of American Magicians, are where anybody can start. You can start there when you're 10 years old. And then from that, you go to the big conventions that they have. And they're very much like a medical convention. There are lectures all day. They have a dealer's room, which is be like our exhibition room where we see all the new gadgets. The only difference is in a medical convention, the first lecture is at noon and the last lecture is at midnight, because people in the entertainment industry, they don't get up early in the morning like docs do. They just want to go to bed before the sun comes up. That's all.
Sign me up. Sign me up.
But as far as getting on stage, I think I was well prepared. Most of the bigger stuff I did after medical school and in residency. So if you train as a surgeon, you kind of probably don't have much stage fright. Younger than that, I don't remember it being a big deal, really. I think I started out small and just slowly got bigger. So I was not intimidated by getting on stage. Maybe that's why I went into surgery, right?
Exactly. That's one thing that gave you a huge advantage, I would have to say, is being in the realm of surgery, is that, especially even where you trained at and where you work at, you see the biggest, the baddest. And if you can make it there, you can literally make it anywhere.
I think so. I think that's right.
Right. I did my general surgery training at Morehouse School of Medicine, and we did our hospital that we used was Grady Memorial Hospital. Just a large.
I've operated there before.
Really?
Yes,
Let's
sir.
talk about that. Was this as a fellow, as an attending?
I go around the world teaching my procedure, which is a procedure for people that have atrial fibrillation. It's not a catheter ablation. It's something a little different. And that's what I do here at DeBakey. And I teach it all over the world. I've been to China 18 times, Japan 24 times, and everywhere from NYU to Cornell to Emory to Florida to all over to out the West Coast, Cedars-Sinai. I spent a lot of time on the road teaching other people techniques. So I've certainly been to Atlanta several times, many times.
Now, this technique is called the mini maze, correct?
Yeah.
Can you describe it to the audience, please?
Well, probably the easiest way to describe it is I use a scope, the same scope that you use to do a laparoscopic procedure or to scope the knee. I use that scope between the ribs, and I open the heart sac, the pericardium. I can see the beating heart, and I can do an ablation and close the left atrial appendage with about a 45-minute operation on the left and right side and get better results than a catheter ablation. So it's a surgical procedure for atrial fibrillation. It includes catheter ablation, but it also includes testing little nerves on the outside of the heart and ablating those. And I believe that most patients that start out with AFib have vagal AFib. There's nothing wrong with their heart. It comes from these little tiny nerves around the pulmonary veins. And as a surgeon, we can see those. Going on the inside of the heart with a catheter, can't get to those. They're not available to you. The procedure, I think last year we did patients here from 32 U.S. states, people that decide they want something a little different, operate on a lot of pilots. Pilots who have AFib get grounded. I mean, there's their whole livelihood going down the tube. They do very well with this procedure because it's a one and done, and they don't have to take blood thinners anymore. So it has a very high chance of stopping their AFib.
What I'm interested in also is I see that you have 2 patents. The patents are related to the mini maze technique.
No, they're not.
Okay.
I have 3 provisional patents I'm working on now too. And I think that kind of gets to the bigger picture. What someone out there listening to your podcast, let's say they're a resident or a medical student, and they really want to make a difference. And I divide physicians into 2 big categories. One are people that are just wood choppers, and we need a lot of wood choppers. You go to work every day and you chop wood, whether it's working in the ER or doing emergency appendectomies. We need a lot of people to do that. But we also need some people that are kind of rainmakers and say, you know what? Maybe there's some way to stop this completely. And that's what Salk and Sabin did with polio.
Polio.
They said, we're not just going to treat it with an iron lung, we're going to stop it. So you need a little bit of both. And to your listeners out there that haven't decided which they are, you can be both. You can be a wood chopper and you can be a rainmaker and go out there and do something different. And you should. And if you have an idea, if it's some unmet need in whatever field you're going into, just write it down. Write it down on a napkin, write it down in a notebook, sign your name and date, and start thinking about it and show it to an engineer. What I found in my experience is that engineers are really smart. They're like physicians. They're really good at pattern recognition. They're really smart, but they don't know what the unmet needs are. They have no clue. If you tell them this is our unmet need and I think I have a solution, they're on it. So if you have an idea, try that. And if you go to other clinicians and they go, oh, I don't think that'll ever work, that usually means you're onto something because you have an idea that nobody's thought of yet. So I would say if you're thinking about going to medical school, go watch somebody like you operate. Come watch somebody like me operate. If you're interested in GI, go watch somebody do some EGDs or colonoscopies and see if you like it. And most physicians are more than happy to have somebody come in and observe them for a day. I'm sure you have that all the time. And more people should do that. I give a talk every year to high school level to anatomy and physiology. And I invite the students. I say, if you're interested in medicine, come in and watch us. See if you like it. And then those are the people that might get an idea. And the people that have the best ideas, biomedical engineers. A biomedical engineering background, I think, is better than a biology background for going into medicine these days, because medicine's now mainly technology. And who knows technology better than engineers?
That's a field that I'm really jealous did not exist when I was finishing or going through undergrad. Because I agree with you.
Biomedical engineering?
Oh, yeah. Well, at least it wasn't available at my school, which was Lehigh University.
No,
but
it wasn't.
And definitely if I had to do it again, I would definitely choose biomedical engineering. And, a couple things you mentioned. One of the things that I liked is what you said. If you have a goal or if you have something that you're really interested in it, don't just keep it in your brain and then wait for it to just, disappear. Write it down, put a date on it, and then start to inquire, ask someone to see if they can help you from a systematic standpoint, get you to your end goal. I love that point.
If your uncle's not a physician or your cousin, it doesn't matter. Go to the hospital and say, I'm interested. And chances are somebody's going to help you out. Don't you think so?
No, I agree. And that leads me to my next point, which is always feel comfortable, questioning the status quo, basically, right? Don't just be the person who says, we got to do it this way because that's the way it's always been like that. It was like this last year and it's been like this for the last 50 years. This is the way it's always going to be done, right? Like we need more people. Obviously, I agree with you. We need more people who are like that to do it the right way. But also at the same time, we need people to kind of just chuck the system a little bit and ask some questions and do things differently and be, up and honest and say, I'm doing it differently because I think we can do it better.
Surgery is pretty bad about that. I mean, the old saying is,
yes,
never let knowledge or reason interfere with surgical dogma. That's the way we've done it forever.
Ooh, we got a lot of dogma in surgery.
We have a lot of dogma, but it should be challenged. And one of the things I'm working on right now is defibrillation of the heart that's in AFib. That technology has changed very little over the last 50 years. You do an external cardioversion, and that's how you get patients out of AFib. But we're working on some new ways to do it that where maybe in the future, if the patient has an episode of AFib, they can turn on their iPhone and defibrillate themselves with 1 joule. So there's some exciting things. And technology, it moves exponentially. It's not linear. So it's a great field to be in, and medicine hooks with technology really, really well.
And now, a word from our sponsor. Meet Dr. Arthur Cummings. He's a busy ophthalmologist practicing all the way in Dublin, Ireland. Recently, he finished Physician CEO. Check out what got him the jump on the transatlantic flight to participate in this program.
My initial response would simply be just do it. This is one of those programs that is so good, it's very likely to be the best education you've ever received. And you realize then as a physician how little we really know about our businesses, even though we're running businesses that are quite large. And the level of training is so fantastic, the education is so good, the faculty is immaculate, and you're in a group of people who are like-minded. So just the entire environment is an amazing learning experience and really a good incubator for growing your practice.
So if you're a physician who's looking to start your own venture or even lead your practice or department, then you can't afford to miss this opportunity. Class is filling up. Learn more at physician-ceo.com/DOTB. Well, I'm interested in your take because with all due respect, you're a bit more mature than I am. You've seen medicine change a little bit, well, a lot more than I have. So I'm interested in your take on, do you think we need more people who are willing to ask more questions about these things, buck the system, buck the trends, in any fashion? And it's really, for me, sometimes I get a little nervous that there are more people in that outside of medicine, people who are in technology, they're working for Apple, they're working for Google or what have you, but not really in the realm of being in medical school. What are your thoughts on that?
Well, unfortunately, what I've seen over my lifetime in medicine is that most physicians are told they need to do X amount of work for the RVUs, relative value units. So it's kind of a reward that has some unintended consequences. And so it doesn't really reward you for saying, I'm not going to do this surgery because maybe there's something better, or maybe I can come up with something so people don't need this surgery anymore. And you go, wait a minute, if I do that, I'm going to have 0 RVUs.
Right.
So there's this perverse incentive to do more of the same because of RVUs. And I think until we get out of that system and get rewarded for just keeping people out of the hospital, get rewarded for keeping people healthy instead of just being rewarded for how many procedures we do, it's going to be difficult. It's hard to think outside the box when your supervisor says, you got to get this number of RVUs this year. And I don't know if your audience knows about that, but certainly a lot of medicine is like that today.
Well, I mean, we have a lot of listeners. Our audience are definitely people who are within either medical school or residents or young attendings. And definitely may not know too much about RVUs or what it is. So if you would like to, kind of talk more about that, definitely. I mean, take the time to
every appendectomy, every procedure, every colonoscopy, every EGD, every cystoscopy has a value, and most physicians are paid determining on the value of that procedure that they do, and their compensation is linked to that value. And if they fall below a certain level, they're told they need to do more work. Where in fact, one could argue the best physician is the one who just figures out a way where you don't need to do that surgery anymore. And like I said before, you need both. You need a lot of people doing those procedures, whatever they are, and seeing patients and evaluating some rheumatologic problem. But you also need people who say, you know what? Maybe there's something we can do, not just to treat it, but to cure this problem. And we've done it before, and a lot of it's come from America, curing TB and a lot of other things, polio that we've done along the way, have been very important. That's when the frog jumps. You're in these periods where you, as a physician, you take good care of patients and you do make them feel better, but the frog hasn't jumped. You're still giving digoxin for something that's been given for 200 years for some cardiac malady. And so at some point, I believe the real goal, if you really want to do something with your life, come up with something that makes it easier for the patient. I think patients really want 2 things. When they see a physician, they want to feel better. Otherwise, most of the time, unless it's just a well check, they don't want to be there. They want to feel better and they want hope. I think that's what they want. And a lot of happiness is hope. If you can give them some hope that you can make them feel better, and you do make them feel better, you got a happy patient. You've done your job. So I do believe that's number one. But number two is always keep in the back of your head, is there something else I can do so my patient doesn't get in this horrible situation in the first place? Does that make sense?
Oh, yeah, it makes a lot of sense.
Even a good cancer doctor still somehow gives the family a little bit of hope and still makes the patient feel better. Even if it's a little incremental thing, that's a good doctor. And I think the worst thing we can do is tell a patient there's no hope. And like an AFib, I hear from patients, well, my doctor told me I'm in AFib. I'm going to be in it for the rest of my life. I just have to live with it and take a blood thinner. And I tell them, no, you don't. And they go, really? And I go, no, there are options for you. And they go, you mean I have hope? Yes, there's hope. And I could feel better? Yes. Man, you just made a friend. That's how you make patients happy.
I love it. I love it. That's a great point.
So for the medical students out there, don't forget that. That's what your patient wants.
I was thinking about this earlier when you mentioned being a part of was it the Academy of Magical Arts?
Yeah.
Not to change direction a little bit, but I wanted to get your opinion on something, or not even your opinion, but what was it like meeting like David Copperfield?
Well, that came about in an unusual way. He called me in the operating room while I was on bypass doing
David Copperfield called you in the operating room?
Right, because he does his homework. He's a very smart man. He's number one for a reason. He's very smart, very logical.
Not to cut you off, but you got to imagine, I'm a kid of the 80s. So I remember watching his stuff on TV, on CBS, his specials,
he's the best.
Chasing you across the TV. You had to keep your hand on the TV and he's chasing you across the TV, or when he went up.
Right.
Remember that one, right?
And he finds your card on the TV.
Yes, I remember that one.
Yeah.
Or he went, I think that was him, right? Or he made
he did that. Yeah, he did that. The other people I'd put in that group, I'd put Penn and Teller next. They're amazing guys.
Right. So
with David Copperfield, I'm doing a case and I get a call in the OR and they said, it's this guy wants to talk to you, it's David Copperfield. And I said, well, I can't talk to him right now. I'm on the heart lung machine. Talked to him that night and it turned out that he was working on a new illusion. And there were some old illusions that were made in the 50s. And I had one of them. I didn't make it myself. I acquired it from a private judge in Washington, D.C. It was a divination box, but it allows you to do some interesting things.
What is that divination box?
It means you make a prediction. And the way David used it, he put the whole trick on steroids. He did an amazing job that nobody else could have thought of. But the basic part of it is you have people pick numbers at random. And in the end, the numbers that these different people picked are inside this chest when you open it up, written out on a big piece of paper. It's amazing, but he took it a lot higher and it ended up being on the license plate of a car that had appeared out of nowhere on the stage. So it was amazing. So what he did was he made sure he had all of the few prediction boxes that were made in the 50s so he could work on them, have them all, and then improve on the trick. And that's why he called me, because I had one of these Pomeroy prediction boxes and he wanted it. And he said, well, let's trade. You come to Vegas and look at everything I have, and I'll take the box and you take something of equal value. And I said, David, that's never going to work because this box is really important to me, but it may not be that big to you. So I don't think we'll ever do a good trade because I'd love to have a new levitation device. He goes, oh, I don't know too much about that. I said, David, you're the number one levitation guy in the world. So we went back and forth for a while. And I said, look, what if you just borrow it from me? And he said, that'll work. And you got carte blanche. Anytime you want to come to one of my shows, I'll put up folding chairs in the front and you can sit right there. So that's what we did. I let him use it. And I said, just give me a letter when you're done with it that said you used it in your show. And he did that. And it was great. That's how I met David Copperfield. The Academy of Magic Arts is in Los Angeles. It's the Magic Castle. It's a private magician's club. It's a wonderful place to go. You do have to know a magician or somebody to get in, but it's arguably the best night out in LA is the Magic Castle. So I do go by there. I was fortunate to be on the stage there once with somebody else. So that was a real kick. And you say, did I ever get nervous? No, but if there was anything a little bit close to being nervous, it was probably that, being on stage at the Magic Castle. You know, the guy who played Doogie Howser?
Yeah, Neil Patrick Harris.
Yeah, he was president of the Magic Castle at one point. He's a magician. He's a magician.
Really?
Yeah. You remember the guy? I'm going back a little bit. Do you remember the show Night Court with
Yeah.
Harry Anderson?
Yeah, the judge.
He got his start in magic. He was at the Magic Castle in L.A. They were both magicians. Oh, wow. Yeah. There are quite a few actors that started out in magic, and some of them went through the Magic Castle in L.A.
One thing I want to ask you, which is interesting, like you mentioned knowing David Copperfield, and you mentioned obviously knowing Penn and Teller. I'm going to ask you a question about them specifically later on, or even Harry Anderson. That's who you're mentioning from Night Court. Like once you make it big, once you're in Las Vegas, or you're on TV and so forth, do other magicians kind of look at those and say like, they kind of sold out? Is there like a derangement in how they, carry their skill once they become really big?
I don't think so. Okay. I don't think so, Nee. These guys and gals at the top work very, very hard. And what they're good at is the same thing that physicians are good at, and that's pattern recognition. They know the pattern. They recognize it. They know how to change it. They know how to make it right. But they work so hard. I mean, David Copperfield at one point was doing 500 shows a year.
Wow.
I mean,
so
you got to
double shows, yeah.
Absolutely. It's because he was traveling too. So he'd be doing 2 shows a day for a week and then go someplace else. I mean, these guys work incredibly hard, not unlike physicians, really not. I respect them. Mm-hmm.
I'm going to ask you a question then. If you could do it again, would you go through the same path, or would you do differently? I got to put you on the spot. Got to put you on the spot.
You just did. That's a big spot.
Well, how about that? Before we get to that point, let's do this. At this point, what are you finding more fulfillment out of?
Oh, number one is taking care of patients. No question.
Okay.
And what I try to do with this procedure I do for AFib, that's kind of a competitor to catheter ablation, is I'm trying to give them hope and make them feel better and get them off blood thinners. And these are the most grateful patients a physician could ever have. First of all, it's a chronic condition.
And also a trauma surgeon, if you know what I mean.
But it's very different, Nee, and I'll tell you why.
Well, the reason I was saying is because they're not coming in at the age of 80 on Xarelto with a head injury. So, that's why I'm saying it's the greatest thing, obviously.
The way it's different is when you have trauma, it's just like when you have acute appendicitis. You don't get on the internet and start researching, man. You got to get to a hospital now.
Absolutely.
Right? You call 911 or whatever, you get to the hospital. AFib's different. It's a chronic condition. So these people get on the internet, they go to my site, wolfminimaze.com. They call us because they got time to research it. You don't do that with trauma. They're very different. So these are patients that are really smart patients. These are patients who said, you know what? I'm going to take charge of my own health. I'm going to get on the internet. I'm going to call around and see what's available. And I give them a lot of credit for that. In fact, I wish more people did it. Now, they can't do it in your specialty. Trauma, you got to get to the hospital.
Oh, yeah, you got to.
For chronic diseases, I think more people are starting to research their own problem to try to find out what's really better for them. I think that's a great thing of the internet, really. And what you do, these sort of things open up more avenues to patients.
Yeah, I agree with you. For the medical students who are listening, or pre-med students, the reason I was bringing up with, it makes a trauma surgeon happy that you can have someone who has AFib not be on medications is, as we're starting to see, as that population is aging, we're starting to see a larger amount of patients who are on anticoagulation medications, blood thinners, come in with falls, and they have, really significant head injuries because they have chronic AFib. So the ability of your procedure to do what it does, and for them to not take these medications, or evil medications, as some of my colleagues call them, I think is amazing.
Anticoagulants and the ER don't go very well together, do they?
No, they don't. No, they don't.
Yeah, that's a much bigger problem today than it was 20 years ago with all the new agents around. And people were diagnosing arrhythmias a lot more than they used to 20 years ago.
Oh, yeah. Absolutely.
You're right. The big question, what would I do if I had to do it over?
Yeah. Which one would you choose?
None of the two. Because what I really wanted to be was a professional baseball player.
Really? So because you want to be a professional baseball player, I'm going to use one of Yogi Berra's quotes. So you had a fork in the road, and if you had to do it again, you would have just taken it.
Yeah, but I was a very good high school baseball player. But I really didn't think about playing baseball in college because my parents said, you need to become a professional and you're interested in medicine, so go for that. And I did that. But if I had to do it over again, I wouldn't know if I'd really good enough or not. I know most people aren't, but I would have loved to try and play baseball in college. And if I was really good, I'd do that. You know what? You can still be a physician after you finish a professional career. I guess most people don't, but you could.
There's a famous one right now. I don't know if you heard of him. His name is Dr. Myron Rolle. He is at Harvard. I think he's in his third year of neurosurgery residency, but he played professional football with the Tennessee Titans, actually.
Okay.
This was like probably about 3 years ago. We heard about this. It was like on ESPN and so forth. But yeah, right now he's at Harvard's. I forget which campus he's at or which hospital he's at. But he's with Harvard. But it's possible, Yeah.
I love playing baseball. So that would be my answer to your question. But if it turned out I wasn't very good, then I think I would have gone the same route I have gone and have a vocation, which is medicine, specifically cardiac surgery, which I love, and an advocation of magic, which in a way is kind of like medicine. What are you trying to do in magic? You're trying to make people happy, right? You're not giving them hope like you do in medicine, but you're trying to make them feel better. It's kind of the same thing. A good magician makes people feel better, I think.
Well, it definitely had me amazed when I was watching magic on TV and watching David Copperfield. It's like, whoa, it was pretty cool.
Physicians are very good magicians because physicians are very good at pattern recognition. That's what gets you into medical school, right? You recognize the patterns. You can take the test.
Yeah, that's a good point. What are your thoughts on the masked magician?
Okay, well, I knew a little bit about that because at one time the Cincinnati magicians got together and they filed a suit against the masked magician in Vegas because what he was doing was he was showing some secrets, and it was a very highly ranked TV show. In fact, they usually ran it during the week, the Nielsen week, when they're looking at ratings. So ratings week, they would run the masked magician because it was really interesting. So the suit from the Cincinnati magicians, and one of them was an attorney, Glenn, it went nowhere. And I think really it made me understand that yes, part of it is the magic, but a lot of it's the presentation. I mean, like I know how a lot of illusions are performed and a lot of tricks are performed. I don't know them all, but I know a lot. But I'll tell you what, Nee, I enjoy a good performance immensely, even if I know exactly what's going on, because I'm still amazed. And I think you could say that for medicine too, and you could say that for surgery. You could be doing some procedure that you do, then you go see somebody else do it, and you still appreciate it if they're really doing a good job. Does that make sense?
Yeah, I get you.
I mean, if they're just really top of their game, you don't mind seeing that, even if you do it yourself. You go, okay. And then sometimes you learn a little bit too from watching somebody else do it. But I think there's similarities there too. So it's fine.
Well, Dr. Randall, we got some fast fire questions that I want to ask you. I'm just going to ask you some questions. You just tell me what comes off the top of your brain. Don't think too hard about it. You ready to do this?
Go for it.
Okay. So knowing what you know now, if you had an opportunity to tell yourself something as a pre-med, some great advice, what would it have been?
The advice would be every time you see an unmet need and you think you might have some other way to solve the problem, write it down and go to an engineer and say, what do you think?
I like it. Or now you can just go to Fiverr.
but I wouldn't go to my colleagues because I did that. And most of your colleagues may not see it the way you see it. And you got to go to somebody outside medicine.
Someone who's actually a problem solver.
Right.
I love it. Well, I was going to say nowadays, with Fiverr, which is I don't know if you're familiar with Fiverr, but it's an online website where you can find people who can do anything for you, whether help you write a term paper or help you even start a new app. Probably one of the ways in which you could probably get and be introduced to an engineer.
Good point. You are exactly right. That's what you should do. That's right. You're right.
So what is a personal habit that has helped you become more successful?
I guess one of my best personal habits is I practice things until I'm really comfortable with them before I do anything in front of anybody. And that's certainly true with magic, but it's true with other things too. And it's true with surgery. I don't mind I did 100 pigs before we did the first mini maze procedure and probably 50 cadavers because I wanted to make sure that I'd practiced to the point where I had it down. So I think my recommendation is anybody out there, practice. It could be something simple like tying knots as a surgeon. Take the suture home and do it 100 times. You know that book, what was it? You got to do something 10,000 times.
I was just about to bring that up to you. Malcolm Gladwell's book. I think it's Outliers, I believe.
Yeah. I think that's true. I agree with that. That's the key. And I think that's been a good habit of mine.
Well, even for someone like you who's as accomplished as you are, is there anyone out there right now that you find inspirational? Someone who's a famous figure that you wouldn't mind trading places with just for 24 hours?
I'd probably say Penn and Teller.
Ooh, okay. What is it about them that you find admiration about them?
They're intellectual magicians. They look at it from a different point, and they look at it from a point that they think would be interesting to you. So it becomes all of what's going on in your head. They get into your head, and they want you to look at this trick. I remember one of the first ones I saw them do, they said, you know what? We're going to do this illusion, but we're going to put you on the backside where you can see everything that's going on. And you go, oh man, that is sweet. This is great. So the cameras go to the backside of the trick where all the action, where all the smoke and mirrors are. Okay. And they still fool you. So I think it's great.
It just shows how great they are at their craft, right? Exactly. Right. Dr. Randall, what's one life hack, or even, is there any piece of technology right now that you use right now, whether it's your iPhone or whatever phone you have, or if you write down everything on a piece of paper to make sure that you have all your tasks done through the day, or maybe the first thing you do in order for you to have the most successful day ever, you always have to make sure you make your bed. What is something that you do that makes your life easier?
Well, I think you said it. It's the iPhone. The iPhone is an amazing piece of technology. I even write my notes on it. I think it's fantastic. It's hard to beat that. It's got more information on it than what they had when they went to the moon 50 years ago, more computing power. So I think that's fantastic. And the other thing I love, or I use, I don't know if you're familiar with Japanese toilets.
Wait, so you talking about a bidet or something, or?
They're heated. When I walk in the bathroom, it sees me coming in, and the lid opens. And the Japanese really know how to make toilets, so I enjoy that too.
I love it. That's what I'm talking about. Hey, I mean, this is how it is on this show. I want everybody to be as open and honest, right? You're going to have all these young attendings on the show typing it up on the web like, how do I get these Japanese toilets to?
Westerners haven't changed the toilets for 100 years. The Japanese have the most amazing toilets in the world, and they're available in the U.S. now. So check it out.
Yeah. I love it. I love it. Dr. Randall Wolf, thank you so much for coming on Docs Outside the Box, man. This was really fun.
Nee, thanks for doing what you do. I think you help a lot of people. You probably help more people every day with your podcast than you do going into the hospital. So thank you for taking the time to do it.
Well, I really appreciate that. And thank you so much for that. Thank you so much for your time. Keep taking care of people. Keep making people laugh. What you do is very important.
Tell them to come visit us in Houston. We always love visitors. Take care.
You take care.
Bye-bye.